Hi everybody, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to talk about why your knee hurts when you sit. A lot of people don't feel that their knee should hurt when they're sitting down. They're not doing anything, they're not using their legs, so why does it hurt? Sometimes it can hurt when you stand up, but it's very odd and disconcerting when people have movie theater knee, they call it, or they just sit down and they start experiencing pain in your knee. So why does that happen? So the one thing that usually is occurring when you have that type of situation is it's more muscle related than anything, which is always a good sign because muscles are fixable. Joints, tend to require more surgery than anything. So it's something that is usually fixable. It is something that you do want to get checked out because it is alarming when you have pain at rest. You would think you stop moving, you stop using your knee, it should go, any pain should go away, not increase or actually start. So it is something you do definitely want to get checked out by a physical therapist or your doctor to make sure it's nothing major. But usually what happens in that scenario is it is a muscle issue. And when you stop using your leg, the blood flow to the muscles decreases. So as you move, as you walk, you're using your muscles, which is allowing this continuous flow of blood, almost like oil in a car. The oil runs through the engine to make sure it's working properly, and if it runs out of oil, your engine seizes and you're in trouble. So that movement, which we always talk about movement being so good and resting is not all that great, helps the blood flow go to the muscles. Well, once you stop and you sit down, while there is still minimal amounts of blood going to the muscles, there's not a lot, so you start to stiffen up. You start to get that pain. And that's why when you go and you sit down, and if you have some muscle related issues, it can cause pain in the knee. Now the difficulty is because all of these muscles from your hip, all of these muscles from your leg, all come up and attach at all different spots in your knee. It's very difficult to pinpoint one exact muscle that is causing that issue, because most of the time it's many different muscles that are causing that issue. It could be tightness, it could be weakness. Again, it's a much more in-depth answer than just saying, oh, it's this one thing. But we do know most of the time it is muscle related. Now what that is a tightness, is a weakness. That's where we have to look at the different muscles in the knee. But the one thing you can do when you have that is actually move more. I know it's counterintuitive, but you want to actually get the blood flow going to the knee. You want to get that blood continuously moving. That doesn't mean to go out and run, but just gentle walking, just to keep that muscle, keep those muscles pliable. Doing a stretching program. If you look at our YouTube channel, Total Performance Physical Therapy, you'll see a foam rolling program, stretching programs. You can do any of those to help loosen up that knee, to help make it less stiff when you sit down. But usually that pain that you feel in that knee when you sit is due to muscles. It's due to the fact that you are no longer moving, allowing fluid into the joint, allowing that blood to go into the muscles. If you or someone you know is experiencing knee pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good day.